Hello, hi sir, how are you? Hi Ajit sir, how are you?
Yeah, fine, fine. Alhamdulillah.
Okay.
Alhamdulillah.
Akram sir, how are you?
Fine.
Yes, you can start.
Nice to have Muhammad Amin and
Yes, finally, yeah, 1-on-1. Yes, yes. I mean,
yeah.
are you waiting for the student to join us?
Yes, sir.
Okay.
So, Osman sir, shall we start or shall we wait for some time?
We can wait a few more minutes. It's okay.
Okay, okay.
Female consistent. The second relation. Only sir reminds you. Reminds you.
I think we should start, sir, now.
Yes,
Dr.
can
Osman?
I'm
Yeah.
Great. So, I'll start this webinar. Uh, Hello, everyone. My name is Mohammad Amin, and I'm your host and for today's webinar. And we are going to discuss about the opportunities for pharmacists abroad and also a career guidance by our speaker and guide, Dr. Akram Ahmad. So we really thank Dr. Syed Abdul Aziz sir and Dr. Usman sir for taking out time to organize this webinar. And now I invite Dr. Syed Abdul Aziz sir Professor and Principal, Deccan School of Pharmacy, to come online and say a few words to begin this webinar, sir. So you can say a few words, sir.
Yeah, Dr. Mohammed Amin, thank you for bringing this webinar and highlighting the facts, because Dr. Akram Sahab, a well-known academician, researcher, right, and now an entrepreneur, is very kind enough to come up with this webinar and giving the info of Australian requirements for the clinical pharmacists. Well, Deccan School of Pharmacy has got 30 seats in PharmD and 10 seats in PharmD postbaccalaureate. So you can see the strength there. So, actually speaking, as though the PharmD programs started in the year in 2008, and having passed 1.5 decades, still we see that there is no extensive professionalism or any ethical quality, and none of the safety risk management frameworks being followed. And students having done 6 years are very much insatiated. And our diaspora are there in Australia also, they are doing very well. And one should be aware that Australia is one of the highest health ranking, world rankings. Out of the 11 countries, wealthy countries, Australia is ranking third. Not even in terms of administration efficiency. In healthcare outcomes, it is number one. And equity in the sense of different people coming from different regions. But the third concern is that there is low performance towards the access of healthcare. And that's why Australia has opened up the opportunities to have more of the healthcare workforce in the pharmacy area to address the national public health costs. So it's a good thing. It's a good start. And our students will be given the overall view of what is going in Australia and how they prepare themselves. And now over to Dr. Akram Ahmad for highlighting this issue webinar. Thank you.
Thank you. Yes, Amin, can I start?
Yes. Yes, sir. We can start now. Yeah.
Okay. So, hi everyone. My name is Dr. Akram Ahmad. So, I'm a pharmacy academic. I have around 11 years experience. I was a teacher in India. Then I work around 4 years in Malaysia. And last 6 years, I'm teaching for pharmacy at University of Sydney in Australia. So today I'm going to discuss about the opportunities for Indian pharmacists in Australia and New Zealand. And this is a very short webinar, like I can say, but end of this webinar, it's like interactive, So if you have any questions, please ask me, feel free ask me if you have any questions, or you can write, in the chat box if you cannot ask, if you want like something, please just note your question in the chat box so I can read your question and I can give the answer. Okay. So basically, as I told you, I'm a teacher, but we started this academically. Last 5 years, I'm making content on YouTube and trying to make awareness, especially the Indian pharmacists, to migrate to Australia. So academically, basically, the company is providing the assistance all the healthcare professionals to migrate to Australia US, Canada, or some other countries. Okay, so as a pharmacist, if you want to migrate to Australia, then you need to write the exam, and academically will help you to pass this exam, and then you can migrate to Australia on permanently. So this is about myself a little bit. So academically basically provide two services. One is for the study abroad. If you want to study in Australia, we can help you to get your admission done. But this is not the recommended pathway because you need to spend a lot of money to study, and then still you need to pass the same exam. So next we provide basically the pharmacist registration and migration process for Australia, New Zealand, Gulf countries, and even some other countries as well. As a pharmacist for Australia, if you want to work in Australia as a retail pharmacist or hospital pharmacist, or maybe you want to work as a clinical pharmacist or a consultant pharmacist. So what is the process to start this? So the first step called eligibility check or initial skill assessment. So nothing but they will just check your degree, whether it is a Bachelor of Pharmacy or PharmD or MPharm. Okay, so all of these degrees are eligible, and then they will check your registration. Okay, so the first step, initial skill assessment. Then you need to write this CAPS exam. Then you also need to write even English test, maybe this IELTS or PTE. I will discuss one by one in the next. It's just an overview. And then same for hospital pharmacist. So basically, if you want to register yourself as a pharmacist in Australia, you can work in retail pharmacy, or you also can work in hospital pharmacy, also as a consultant pharmacist or clinical pharmacist later on your age. Okay, but and for this pathway, do not require any work experience. So if you are a fresher, you just completed your pharmacy degree, you can migrate to Australia without having any work experience. I mean, zero experience, you can migrate to Australia. You just need to pass the exam and complete the process and can migrate to Australia. The another route is that if you completed your degree and now you are working in the pharmaceutical industry, especially in the manufacturing side or QA and QC, then you can migrate as an industry pharmacist. But the opportunities is very, very low as an industrial pharmacist. The maximum jobs, I can say about 90+% jobs are available in Australia. And retail pharmacy, in hospital pharmacy, the reason is that basically Australia have only 8 pharmacy colleges. Currently in India, we have around 6,000 pharmacy colleges, right? And here in Australia, only 8 pharmacy colleges. So they are not producing enough pharmacists. That's why they require around 3,000 pharmacists every year from overseas. They are given the visa. Okay. That's why they need a lot of pharmacists in Australia. So in industry, basically, this is a high income country. So mostly the companies are working, basically manufacturing, they are doing in India or China or some other countries, and they are export to medication to Australia. That's why not many opportunities are available in industry. So maximum jobs are available in the retail sector and hospital sector. Also, if you are a diploma holder, you also can migrate to Australia, but you cannot work as a pharmacist, but you can work as a assistant or a pharmacy technician to assist to a pharmacist. Okay. In this case, I will discuss. Also, there is an opportunity for in academia. As I told you that the universities are very, very limited. 8 pharmacy colleges. So academia also very low jobs. Even people are completed and they are working in retail sector, in hospital sector. But still, if someone wants to apply as a university lecturer, they can apply. At least 2-year work experience, teaching experience required. But they need high, basically, the score basically in Australia, basically they give the visa based on the point-based system. I will discuss in my later on slides. So the first step I told you is like initial skill assessment, then CAPS exam, then English. So the Australia and New Zealand have the same pattern or same steps you need to complete, but you have to decide first where you want to migrate. There is a little bit the very small difference basically. To migrate to New Zealand, they require 1 year work experience in any retail pharmacy or hospital pharmacy after you completed your bachelor degree, whether it is a Bachelor of Pharmacy or PharmD or MPharm. Okay. But in case of Australia, no work experience required. I mean, zero work experience, you can migrate to Australia. Or maybe if you are working in some other field, for example, you are working as a medical rep, or maybe you are working as any like pharmacovigilance, clinical research, medical writing, medical coding, because these experience not counted as a pharmacist. So still you can migrate to Australia as a pharmacist. Basically, this experience not required for migrate to Australia. But in case of New Zealand, the work experience is mandatory at least 1 year. Then only you can apply. Another major difference is that Australia provide unlimited attempt. If you fail in first attempt, you can give second time, third time, fourth time. But in case of New Zealand, only 2 attempt. If you fail, you cannot write third time this exam. This is the major difference. And this skill assessment also is the different. If you want to work in Australia, then you need to apply for APC, Australian Pharmacy Council. Academically will help you, no worries. You just need to provide us your documents. And secondly, if you want to apply for New Zealand, then you have to apply for New Zealand Pharmacy Council. And then you need to write this CAPS exam. CAPS exam is an online exam and center already available in Hyderabad. So you can write this exam in your home country and then you can come to Australia. Then also you need to require this English test also. I will discuss one by one here next. So skill assessment, basically nothing, but they will just check your eligibility. So any 4-year bachelor degree holder, they pass the degree, they are eligible to work in Australia. So just only 2 requirements is mandatory. One is that your degree must complete it, plus you must register in your state pharmacy council. And they need some documents like your degree, your transcript, or your state pharmacy council application, passport, national ID like Aadhaar card or any birth certificate. If you don't have, maybe you can provide like 10th certificate, mark sheet, and passport size photograph. These are the documents you need to submit with Australian Pharmacy Council. And you need to pay the fees around 1310 Australian dollar. If I convert it into a Indian rupees, around 65 to 70,000 Indian rupees you need to pay for this step 1, or first step you need to complete to submit your application to a Australian Pharmacy Council. And next step, basically this is, I'm sitting here. This is my first photo I came to Australia in 2017 at the University of Sydney as a PhD student. So this is basically a oldest university in Australia, and this is the first pharmacy school in Australia established in 1859. Okay, so this is one of the oldest pharmacy school in the world. Yes. And next, basically, you need to write this CAPS exam. So CAPS exam is a full form, basically knowledge assessment of pharmaceutical sciences. So whatever you study in your 4 years, they will just want to check your assess, basically, that you are basically, fit to work in Australia. So this exam, I can say, is a very, very easy exam, even if we compare to GPAT in India. Okay, this is basically a mediocre exam. Anyone can pass the exam. So for this exam, you need to pay around the fees 2230 Australian dollar. So altogether, you need to pay around $3,540 to Australian Pharmacy Council. Okay, this is a government fees you need to pay. So this exam, basically, they will check your knowledge in the 4 domain. Domain 1, pharmaceutics, and then pharmacotherapy. Especially if you are a PharmD student, very, very easy for you to crack this exam. And domain 3, pharmaceutical chemistry, and then physiology and pharmacology. Okay, so in this exam, basically, no negative marking, and 50% only you need to pass. If you can score 50 out of 100 questions, so basically in a same day, there is a day one, you need to sit in the two papers you need to clear. Paper 1 and paper 2. Paper 1 basically covered pharmaceutical chemistry, physiology, and pharmacology. And they will give you the 100 questions, multiple choice questions 100, and you need to score 50%. And then there is a 1 hour gap. Then you need to write the paper 2. Paper 2 basically based on the pharmacotherapy and pharmaceutics, mostly like calculations and all those parts it will be covered in this. So these two papers, again, they will give you the 100 questions, multiple choice. You need to score 50%. And there's no negative marking, so you need to attend all our 100 questions. Even if you do not know the answer, you just guess the answer, you can pass the exam. So if you can correct 35 questions out of 100, I can say that 100% you will pass, because that's for the 65 questions. If you can just guess, definitely you can score 15 correct answers and easily pass this exam. So passing this exam is not a problem. In our last exam, 93% students passed from our this March exam. And maximum of them already got the visa. Now they are in Australia. They are working as a pharmacist. So after you give the exam, it may take around 2 to 3 weeks to give the result. Then you need to write. So this exam, basically, you can write in your home country. So there is 8 centers are available. Basically Hyderabad, Chennai, Bangalore, Mumbai, Pune, Delhi, and Noida and Gurgaon. These are the 8 centers currently in India. So you can write. So and this exam is basically conducted yearly 3 times: March, July, and November every year. So currently we are taking the intake for this November exam. So this is, if you might be know, the Pharma Tutor, one of the very famous website in India. So they just covered in news about us. So in our last exam, 93% students passed this exam in their first attempt. So skill assessment we will do for you. You just need to provide us your documents. And next, for this CAPS exam, we'll provide you the 4-month coaching. Basically, coaching means they will provide you 3-month sessions, live sessions from Australia, and 1 month the revision. So we'll complete A to Z. We'll provide you we cover in the live sessions, live lectures. So you just need to revise the content and pass the exam. Then next, you need to pass one English requirements, maybe the IELTS, OET, PT, or TOEFL, any exam you can give. But if we compare all these exams, the PT is very, very easy as compared to others. But some may think that IELTS are easy. So it's up to you which one you want to give. But recommended, basically, you can go for PT, OET, or IELTS. The PT is very, very easy as compared to others. If I can say, like, if your score is 6 in IELTS, then 7 you can score in PT. Or if your score is 7 in IELTS, then 8 you can score in PT. So PT highly recommended if you are planning to migrate to Australia. And then industrial pharmacist also, if someone already completed degree working in pharmaceutical industry, now they want to apply as industrial pharmacist. Then again, you need to apply for skill assessment, then PT exam, then EOI and visa. There is no CAPS exam required, but the visa, it may take long time. It might be, if you pass the exam within 4 days, 5 days, 1 week, nowadays people are getting the visa. But for pharmacists, can't say anything. It may take longer time, because basically the visa they issue based on the occupations and demand of that particular occupation. So industrial pharmacists, not that much high demand in Australia. The retail pharmacists, number 1, in hospital pharmacists are in the high demand in Australia. So I can say the very, very good scope, especially those are B.Pharm and PharmD graduates are looking to migrate to Australia. Same for technician, it may take a lot of time. To grant the visa, might be 6 months to 1 year. But in case of pharmacist, it might take 1 week. So you can see the image, so it's very, very easy. pathway to go for the pharmacist pathway. So once you completed your initial assessment, then you pass the CAPS exam, then you pass the English test. Now the time for the visa. So you can apply that permanent visa from India. This is like subclass 190 or 491. These are a lot of our students, most of our students, they pass in March exam, they got this visa. So these are a permanent visa. And if you are like married, if you have a wife or husband, altogether you can migrate with your family on this visa. And healthcare are free in Australia if you migrate to Australia. And the education for children also free in Australia. Okay. And apart from this, some students, if they want to migrate on a work visa, so also you can apply like 482, 494, and 407 visa. So since once you pass the exams, you have two routes. One is that you can apply your own permanent visa and come to Australia and find a job. Academically will help you to find a job as well. We provide the job assistance. And for work visa, you have to be in India and find a job in Australia. Company will sponsor your visa, and then you can come to Australia. So this second option might be looking easy for you. So might be you are thinking that I can go on work visa, so easier for me. But I highly recommend it, go for your permanent visa. This is your own visa, so you can get Australian citizenship within 3 years. But if you are coming on work visa, then you have to buy insurance for your family or for your kids if you have, and also for them you need to pay the fees. But if you are coming on work and the PR visa, permanent visa, then education is free for your family and healthcare also is free for your family. So you no need to worry all those things. And secondly, in work visa also, the company may give you some condition. Condition is that you have to work that certain time for the particular pharmacy. For example, you need to work for us 3 years, 4 years, or 5 years. They may give you the condition. But this is Australia, very safe country. So no need to worry. If someone is giving you a condition also, you can come. They will pay you the salaries. Okay. So here is a very, very strict law. So the employer cannot, reduce your salary and anything. Okay. So this is already the fix. Most of the students ask me one question, sir. Once I pass this CAPS exam in English, do I need a sponsor for the visa? So the answer is no. No need to have any sponsor. The state government will sponsor your visa 190 and 491. So you will get permanent visa. But in case if you are looking to migrate on a work visa, in that case, you need to have a sponsor. So they can sponsor you 482 visa, 494 visa, and 407 visa. These are 3 visas. What is the difference in these 3 visas? If you have at least 2-year work experience, then you may grant, they may offer you 482 visa, 494. But if you have a 0 experience, no experience, then they will give you the 407 visa. Okay, so you can come on this visa and can apply later on your PR visa if you want. So your first job in Australia, you have to work as an intern pharmacist. So this is not Indian PharmD intern like you are working free of cost. This is a job basically. They will pay you around $30 per hour salary. So in Indian rupees, if I convert it around more than 3 lakh rupees, Indian rupees per month, you will get once you complete this process. And then you can, after 1 year, you can become a pharmacist. So you can work in retail pharmacy continuously, or if you want to move to hospital pharmacy, you can. Or after you become a pharmacist, then there is a special course to become a clinical pharmacist or consultant pharmacist. So there is a SHPA, there is an association in Australia, Society of Hospital Pharmacists in Australia. They provide this clinical pharmacist course. Those are already registered pharmacists. So for example, if you are a PharmD holder in India, so you think that you are a clinical pharmacist and you can work in Australia. So you cannot. So first you need to register yourself as a pharmacist. Then you complete your training to become a clinical pharmacist in Australia. So most of the students are they are coming to Australia, they become pharmacists, and simultaneously part-time they start studying to become a clinical pharmacist in Australia. So on an average salary in Australia, around $100,000 per year for a pharmacist, so around 4 to 5 lakh per month, I can see. And average time may take around 6 months to 1 year to migrate to Australia. But nowadays, pharmacists are less than 6 months. They are getting the visa and coming to Australia. The total, because 3 to 4 months will take for you to pass this exam, up to 4 to 5 months. Then you apply your visa. So around 6 months, it can complete the process. Here are some reviews for Google from our company, Academically. And if you have any questions, so you can directly ask to Sadiq or Amin. And now, thanks for watching. I mean, yeah, you can take your questions. Oh, now, guys, you can ask any questions if you have any doubt or anything. Or if you cannot, so please write your question in the chat box so I can read and give you answer. Yes, sir. I mean, can you please share the feedback form also?
Sure, sir. I'm sharing. Yeah.
Yes, sir. Adi, sir, do you have any question?
Basically, clinical pharmacists, our students,
Yes.
having that 6 years course here,
Yes.
it is very clear that they need to pass the CAPS exam by the APC. That is sure.
Yes.
And there are no considerations. And 1 year internship they have to get into institutes, I think, hospitals.
So basically, I mean,
Yeah.
whether you are a
That is
B.Pharm or PharmD or M.Pharm, even if you are a PhD holder also, if you want to become a pharmacist in Australia, so same exam you need to pass this CAPS exam and become a pharmacist. And then if you want to become like clinical pharmacist, or then again you have separate training for that. There is no
now there is demand for visas, job visas, especially in the community. And the clinical pharmacy area.
and basically in Australia, in community pharmacy also, they are a clinical pharmacy, basically, I can say, because pharmacists have a separate room. So lot of, for example, diabetes patient are coming there, or asthma patient are coming there. So they are basically give them a specific treatment for them. So they can guide them the right medication, they review their medications, they give the counseling for them. Even retail pharmacy also, they are doing the same job what we are expecting in the hospital in Australia.
Yeah, Dr. Akram, now the student, okay, he will clear the CAPS exam for PharmD. It is very easy. They will do it.
Yes.
Definitely. Inshallah.
Yes.
Right? Now, they will be looking for approved hospitals training of 1 year, which is required, right? For getting into clinical pharmacist course. So you and your association need to provide those past CAPS exam students the approved institutes for necessary training, or they have to fend themselves in searching for.
Yes, sir, it is very, very
approved.
easy. Basically, Australia provide every year 195,000 permanent visa. Okay. And around only 3,000 they need pharmacists. 195,000 total visa, and 3,000 around for pharmacists. And these vacancies are already available. If you go to seek.com.au, currently more than 3,000 jobs are available. Any pharmacist start coming within few days, they are getting the job. I can that last 2 weeks before, one of our student came here. Ahmad is his name. Another girl is from Hyderabad, is Asra. She got the visa for Victoria. So they guys came to Australia on permanent visa. Within 2 weeks, they got the job. So a lot of our students, they are coming and getting the job. Yes, academically help them basically, what a CV they need to change as per the Australian standard, how to write the cover letter, what are the website to apply, what are the consultancies here helping for the job. So finding a job is very, very easy here. This is not like in India, one post or 100 people are applying. Here, one post, maybe the one or two guys are applying only, so not that much competition in Australia. And they need a lot of pharmacists, basically, especially in the rural and regional areas. So those rural areas, not like our Indian rural areas, all facilities are available. So in my last 6 years, not a single pharmacist I'll know he or she passed the exam and not getting a job. So within 2 to 4 weeks, 100% you will get the job. The job is not a problem. If there is a problem in the job, they will immediately stop giving the visa, because they are giving you the permanent visa, they're giving you the citizenship. Why they have to give you citizenship if there is no demand? They only give the citizenship if there is a demand for your occupation. So pharmacists are getting a lot of jobs. Jobs is not a problem in Australia.
I like the specialized ones. One of my students want to become an oncologist or oncology pharmacist.
I can read some questions, I think, from the student. Bhuvneshwara Ramanan asking how the question pattern for CAPS exam, sir. So CAPS exam basically is very, very easy exam. I can say. So mostly they ask basically the question from the practice side. For example, there is a case scenario, and patient are taking the dose XYZ 3 medication, then you have to find out the problem and give you the answer, So, and most like sometimes like side effect, they will ask the very common drug of choice. Sometimes they ask for a particular condition, those kind of questions they ask. So exam questions is not very, very tough. Around 80% questions are very, very easy. 20% are maybe the little bit the tricky questions they ask. Mariam is asking, do we have to get 50% in every subject or overall? Yes. As I told you, there is a 4 components: pharmaceutics, pharmacotherapy, pharmacology, and chemistry. So you have to score 50% in each component, each subject. And Aisha asking about the SHPA. So SHPA is basically association, Society of Hospital Pharmacists Australia. Okay. So they provide, if someone want to become a clinical pharmacist in Australia, so they provide that training, or you need to pass the BCPS, board certified clinical pharmacist, especially that we know that US, they conducted the exam, right? So you have to pass any of these 2, then you can become a clinical pharmacist. But this is not very, if you become a clinical pharmacist, you will not get any extra salary or something, the salary will be the same, This is not like very special status for you. Even community pharmacist also a clinical pharmacist in Australia. Okay. Yes, consultant pharmacist something different. So they can consult the patient. For example, here the rule is here. So they can review 10 patients per day as a pharmacist, as a consultant pharmacist. So for example, someone is like a geriatric population, they are using multiple medications, so they have to review their medications, and they will charge for the government. So in Australia, everything is free basically for the patient. And as a doctor, if I want to go to doctor, if I want to go to pharmacy, or if I want to go to any laboratory test or any scan also, so everything is free here. Everything they have to charge to the government, and government pay to behalf of the patient. So patient no need to pay any money here. So clinical pharmacist, mostly a consultant pharmacist, once you become, then you have to review basically the medication. So here is this is not like in India, mostly the physicians are not that much cooperate to a pharmacist in a hospital settings. Okay. But here you need to review the medications every day, especially in the IPD pharmacies. Even the pharmacy, if they are coming to take any prescription to a pharmacy, again, you need to ask the question and try to understand the situation of the patient. Is there any drug interaction related inquiries, or is there any something the dose need to change, or medication need to change? Immediately, you need to respond to the clinician or the doctor. So, lot of interventions suggested by a clinical pharmacist or hospital pharmacist in Australia in generally. Okay, so SHPA, they conduct the sessions, so you can contact them once you become a pharmacist. So your job now to pass the exam. So don't think that after 1 year I'm asking about and what going to be about the SHP and all those things. As you know, the BCPS or SHP, any of these two, you have to pass to become a clinical pharmacist. And Amin already given here the one form, feedback form. So please this form. So our team will get back to you after this conversation if you have any questions later on also. Yes, Mariam, I told you already, this is every subject you need to pass 50%. Shoaib asking, can we get the permanent residency? Yes, 100%. I mean, you will get residency. Nowadays, people are getting within 4 days, 5 days. As I told you, we have a lot of students from Hyderabad already join us. A lot of students already got. This Asra, I told you, this girl, she have three children basically, and she was not working anywhere. She was basically a housewife. Her husband is a engineer in Saudi Arabia, I know. So she passed the exam and got this PR visa. Now she's moving to Australia with his family. Okay. So once you pass this exam, you are eligible to apply permanent visa 190 and 491. Yes, please. Any other question? Yes, we basically provide last 15 years question papers. So what we do, we basically give it like a, for example, like CVS or GIT or respiratory system or maybe calculations. Okay, so we will finish the theory part, then we will ask you discuss some of the questions, whatever they ask in previous years, last 10 years. Then we will give you the specific mock test for that particular topic. Then you have to go to attend the mock test. If your score below 50%, our faculty will find out to you and they will sit one-on-one with you and try to understand what is the problem, why you are not scoring well, and all those things. So how we can improve your score. So passing the exam is very, very easy. You can easily pass. No, as I told you, this exam you can give in India. The 8 centers, including the Hyderabad. Hyderabad is the center is there, so you can write this exam in your home country. So currently we have 8 centers in India, like Hyderabad, Mumbai, and Chennai, and Bangalore, and Pune, Delhi, and Noida, and Gurgaon. You are the 8 centers in India. Yes, Ikra, I already told, yes, once you pass the exam, CAPS plus English, both are mandatory. So once you pass these 2 exams, you are eligible to apply your permanent visa directly. And Zunaira, no, Aminatai exam already you can write in India. No need to come to Australia. Okay. Exam, exams you can write in India. Only you need to travel Australia once you got your PR visa. Okay. So सारा काम आपका इंडिया में ही होना है. Basically, we provide the coaching basically for this exam. So there is no such materials you can pass this exam. If you go CA syllabus, then you will think that you cannot pass the exam. So we make our own syllabus, and based on that, we are we are teaching, because this is a very short course. We provide 3-month live sessions, live coaching, and you just need to revise those content for 90 days. So 3 hours if you can give for 90 days, definitely you can pass the exam. But there is no website to see any previous year question papers, because question paper is not given by the Australian Pharmacy Council. These are the recall based. For example, our 50-60 students going to sit in the exam, different city, different countries. So we ask them the questions and memorize some questions. Then we try to recreate those questions, and we share with our students. Offline course, how we can maybe 1 or 2 students maybe we will get in offline. So this is an online course only, because we have students around 50 countries. It is not just India. We have students from Canada, even some students from Hyderabad. They went to study in Canada, and now they are struggling in Canada to get the job and become a pharmacist there. If I compare this exam, compare with exam this PEBC, PBC very, very tough exam and passing it about 20%. In case of Australia, CAPS exam is very, very easy. 93% student pass from our academy in last exam. And in general, also 70% student pass in their first attempt this CAPS exam. So this is exam, basically the PBC, the passing percentage, only 60% you need to score in the exam. But CAPS, you need to score 50% only. Please fill this form. I mean, time, please share the form. Please fill this form so our team will get back to you about the fees. And even we have a EMI facility also. So if you are struggling in financial, so we can provide up to 12 months, 1 year, 12 months, that interest-free EMI option we have. So you can join us. So no need to worry about the finances also. But on an average, you need to around total expenses around maybe 4 to 5 lakh maximum you need to spend to come to Australia. Total, including your airfare, your visa, everything I'm telling. Please fill this form so our team will get back to you regarding if you have any question, they will talk to you one-on-one. And if you want to any of your family member talk to them, to our team, they will give. So please fill this form so you can talk to them one-on-one. Okay. Yes, exam conducted yearly 3 times. March, July, and November, yearly 3 times. Okay. So next exam is going to be held in November in Hyderabad. You can write this exam. Basically, we have our own syllabus. That's why I told you. Right? So you just need to revise those content. Even those we have mock test. Most of the time, sometimes 80% the questions come from that mock test. So itself just passing it 50%, right? So only those students only, last time we have around 60 students sit in the exam and 56 passed in their first attempt and 3 of them pass in one exam and another one is only the failed. So the failed exam, she never attended our classes. She was not, following our instructions basically. So if you sincerely, if you can study 3 hours per day, definitely you can pass the exam. Yes, Ikra, any other question, please? Please do ask me live if you have any questions you can ask. You can just unmute yourself. Please unmute. और ये आप फिल कर दें आप फॉर्म को, तो अभी भी हम लोग कनेक्ट करेंगे आपसे. कोई भी क्वेश्चन है बाद में आपका तो. यस, मैंने बताया इंटर्नशिप नहीं है, पेड जॉब है. दिस इज ए जॉब बेसिकली. तो $30 पर आवर आपको सैलरी मिलती है जब आप एग्जाम पास कर लेते हो. तो मैं आपको एक लाइव एग्जांपल दिखाता हूँ. हमारा एक स्टूडेंट अभी आया था जो है यहाँ पर, अभी उसको जॉब मिल गई है $30 पर घंटे के हिसाब से, और उसको जो है रहने के लिए घर दिया गया है फ्री ऑफ कॉस्ट. मतलब उसको एकोमोडेशन दिया गया है 3 ईयर के लिए. ठीक है. तो ये अहमद हमारा एक स्टूडेंट है, ये अभी रिसेंटली आया है यहाँ पर. ठीक है. तो मैंने उसको ये 27 मई को मैंने उसको पूछा, हाल चाल मिला, मैंने उसको पूछा हाय अहमद, जॉब स्टार्ट हो गया किया? तो उसने कहा सर मंडे से है. मैंने कहा कहाँ पर है? तो उसने बताया ये रुशवर्थ एक जगह है, वहां पर इसकी जॉब लगी है. ठीक है. विक्टोरिया एक स्टेट होता है ऑस्ट्रेलिया में, वहां पर इसकी जॉब लगी है. तो मैंने उसको पूछा सैलरी कितनी है? तो मैंने उसको पूछा $28 मिल रहे पर घंटा क्या? उसने कहा नहीं सर, $30 पर आवर उसकी सैलरी लगी है. और फिर उसने आगे कहा कि सर मुझे फ्री अकोमोडेशन मिला हुआ है. ठीक है. उसने फॉर 3 ईयर्स. तो 3 साल तक उसका अकोमोडेशन फ्री है, वो भी फुल्ली फर्निश्ड हाउस. और $30 पर आवर इसको मिलेंगे इंटर्नशिप के अंदर. और जब इंटर्नशिप खत्म हो जाएगी 1 साल के बाद, फिर उसको सैलरी मिलेगी $40 पर आवर. तो ये अभी अराउंड इसको मिल रहे हैं 3 लाख प्लस इसकी सैलरी है यहाँ पर ऑस्ट्रेलिया में. और इजीली इसको घर भी फ्री का मिला हुआ है वहां पर रहने के लिए. तो बहुत सारे टाइम्स में जो है कंपनी भी दे देती है आपको घर, अगर आप रेडी टू वर्क. Please fill this form, Hariram. Fill this form so our team will get back to you and they will give you the information regarding the fees and all those things. Okay. Any other question? Please fill this form so our team will get back to you one-on-one to you. So you can ask them any questions, whatever you have. ये वाला फॉर्म आप फिल कर दें तो हमारी टीम आपसे कांटेक्ट करेगी one-on-one. So easily you can communicate with them, you can talk to them whenever you want to enroll, or if you have any questions, anything. Not a single student ask, live questions. This is the chance for you to ask directly to, if you can just unmute yourself and ask your question.
Yeah, due to
Sir, Ikra is
we-
asking, can we get a social media account so that we can follow you? Yes,
Yes,
Ikra, you
I
can
am
get.
basically on YouTube basically, so you can follow me on YouTube. So if you just type on Akram Ahmad on YouTube, okay. So this is basically live. We are going here. So here, these are my YouTube channel. So you can follow me here. I'm also available on Instagram also. So so you can also find out on me on Instagram also. On Facebook also we have a pages, so you can follow me on Instagram, on YouTube and Facebook. Okay, please subscribe here on this YouTube channel, so you will get a lot of updates regarding the Australia, wherever you basically you want to go to in abroad. So basically wherever the opportunity for pharmacists to get the visa, so I always make the video content. So recently I make this video like 50 points. This is the minimum point student are getting the visa. A lot of our students got this visa on 50 points in last week. Okay, and this is one of the student. Basically, our student, she passed the exam, and she also our student. He also our student. He also our students. A lot of students basically they pass the exams, and we have a lot of success stories on this YouTube channel. So you can subscribe the channel, and if you have any question, you can also can ask by comment. Okay. Please ask, unmute yourself and ask your question. ये हमारा YouTube चैनल है, तो आप लोग फाइंड आउट कर सकते हैं YouTube पर डॉक्टर अकरम अहमद के नाम से, और आप उसको सब्सक्राइब कर सकते हो if you want. Yes, please. कोई और क्वेश्चन है किसी का? Do you know any single pharmacist from India recently went to UK and in Ireland become a pharmacist? The very lengthy process, and not that much opportunities are available in Ireland. I have already made videos on Ireland, Germany, and Sweden, Finland. A lot of countries I already make the videos. But the problem, London, there is one video I recorded yesterday only. So it's going to be live after 1 day or 2 days in my YouTube channel. So it may take around 8 to 10 years to get your citizenship in UK. In Australia, you can get within 6 months. Okay, so very, very easy, very, very fast process. And UK, there is a course called OSPEP. OSPEP. You need to enroll in that course, and you need to spend around 30 lakh. And for Australia, you just need to invest just 5 lakh rupees, including your visa and all those things.
Dr. Akram, I'll be leaving because I
Yes.
have
Okay.
some work. I'm leaving. Huh?
Yeah, sure.
Okay. Thank you.
Thank you. Bye. Please, if you have any question, please ask the question. Otherwise, we are going to finish or also leave already. Please fill this form so our team can, ask you. They can give you all the required information. इस फॉर्म को आप fill कर दो तो हमारी टीम आपसे कांटेक्ट करेगी one-on-one, और जो भी आपके क्वेश्चंस हैं वो आपको फिर से क्लैरिफाई करेंगे. और स्टिल इफ यू नीड टू टॉक टू मी one-on-one, they will arrange your session with me. Okay, so please fill this form. Please fill this.
Ikra is asking, sir, any special preference that will be seen in our CV?
Nothing. I mean, if you are a PhD holder also, you need to pass the same exam. So nothing special. Any degree, you are a bachelor degree holder, B Pharm, M Pharm, PharmD, PhD, everyone has to pass the exam. Because they are hiring you to work in the retail pharmacy, hospital pharmacy. So even if you are a higher degree holder, still you need to work the same work. You are nothing special, if you have a higher degree holder. So if you are a PhD holder, they will give you 5 additional points for the visa purpose. But apart from this, there is no advantage. But if you have some work experience in India, then definitely there's an advantage. They can give you 5 additional points if you have a 3-year work experience. And yes, and when you are looking a job also, they may give you some advantage. But apart from this, there is no advantage. Okay, please fill this form. Then you will get the response from our team. Any questions?
Yeah, so if your questions are actually unanswered, you can mention your question also, and we will come back to you with the answer.
Please fill this form, so our team will get back to you. So I hope sir already leave basically this session. So I think now I can finish.
Sure, we can wrap up. Ikra is again asking, sir, how many total points we need to get citizenship?
65 points. 65 points you need to get your PR visa, permanent visa. Okay. So please, we are finishing here. So please fill this form, Ikra. So our team will get back to you if you have additional questions. And please, you can mention your question also. So they will call you back and they will give you all of your answers. Okay, guys. And thank you so much for your time. Bye-bye. Bye.
Thank you so much, everyone. Bye. Thank
Bye.
you.
Thank you.